With ballroom dancing, there's a pose and a posture. Across the right breast, I started getting pangs of pain. So the minute I raised my arm, I felt it. It was a very, very painful and sudden twinge. I went to see my physician. Biopsy was done, needle biopsy, mammogram, etc. And he said to me, "Bev, it is cancer."
By identifying a breast cancer in stage 1, that is up to 2 centimeters, the 5-year disease-free survival is 98.5%. But if it's a stage 4, where there's spread already, only about 20 to 25% of patients are disease-free at 5 years.
I looked at it from a point of, I'm this side of a rickety bridge. There's help on the other side. To get across this rickety bridge, there's one hell of a pit of despair that's underneath. And I wasn't going to fall into that pit at all. The cancer had spread into the lymph node, and that was the pain under my arm. So they had removed the lymph node as well, which meant I had to undergo very aggressive chemo, and that was called the Red Devil.
You must feel you're in the best hands, you're in the right place. So it is a tango between the team and the patient. It is one of the biggest stressors that happen in your life, but it is not a death sentence anymore. Breast cancer is treated with chemicals. That is how you cure the disease. And you always have options for surgery.
Hospital was a home, cancer care was a home, chemo room was a home. But there was a life in that chemo room that consisted of a lot of hope. A lot of hope given by the oncology nurses, oncologists, etc. It wasn't easy at all, because 14 days after my first Red Devil chemo, my hair was gone. I was bald. I had to deal with being bald. It doesn't come easy. Your scalp is sensitive and you're aware of another you. And I had to also tell myself, it's the way I approach this whole journey, crossing this bridge, that's going to make a difference.
And the one thing that I want to ask each and every patient is, you've got to realize when we manage breast cancer, it is in a combination, a multi-disciplinary clinic. And in that clinic, we will have the radiologist looking at the mammogram, the pathologist to tell us about the type of breast cancer, telling us what comes first. Surgery is not always first. The third person that is very important is the genetic counselor. If you have a gene that promotes breast cancer, you can't just focus on the one lump that you've got now. You have to identify the risk of having breast cancer again in your life. So then we sit together, the patient, the oncologist, the surgeon, and the reconstructive surgeon. When we decide about surgery, we decide what is the best for the patient.
The music makes you forget. You cannot think of anything uncomfortable while you are dancing. And dealing with all the physical things of cancer is not easy. But I was in such good hands that every step was accounted for. I was never left alone to battle.